So when it comes to treating health problems, you've got a couple of choices. You can go and see your doctor, and that seems to be the most common thing people do, or you can come and see a naturopath, which is a little bit more of an alternative consideration. Most people really don't know what the difference between those two things are. Well, they're probably clear on what a doctor is, but naturopaths, really fall under a really interesting kind of umbrella. And I should say it's kind of hard for the average punter to work out who they should see when it comes to a naturopath, because the laws in Australia have kind of left it open for anyone to really practice as a naturopath. Thankfully, we've self-governed our profession, and from that perspective, you just simply have to find out whether they've got a university degree and whether they're covered by a private health fund, and you're kind of set to go. But with that said, the real difference is that a doctor uses the disease model and a naturopath uses the health model. So the disease model is all about looking at your signs and symptoms, getting a label, and treating that label with a one-size-fits-all, scientifically tested protocol to give you relief. And it does. You will get relief when you see a doctor. I'm not an anti-doctor naturopath. I think we need everyone. Naturopaths, on the other hand, use the health model. The health model says when you come in with your signs and symptoms, those signs and symptoms are trying to tell you something. So we look at those and we say, well, there's a picture there, and those signs and symptoms are alarm bells. They're alarm bells that are there simply because something about you isn't working properly, or something that you're doing is putting you under pressure. So we're all about finding out the answer to you and what you do. So to kind of give you a sense of what that might look like, if 10 people walked into the door to see a doctor, and so they all were diagnosed with asthma, that would be their label, and they'd walk out the door pretty much with the same treatment. They'd get a bronchodilator and an anti-inflammatory preventer, and they'd feel better. They'd get some relief, and there's no doubt that that's an option. If those same 10 people came to see me as a naturopath, I'd look at what they were doing, I'd look at what was not working well in them, and I'd work out why they had asthma. So I would treat them all differently. They might have asthma because it's stress related, they might have asthma because it's allergy related or lowered resistance or whatever. But there's a difference. So it's just another way of looking at it, but obviously I'm passionate about this way because I think it gets to the bottom of why. And you don't end up having to take long-term medication when it comes to that. So we need both, and there's certainly times when you want to get relief because you've got a big event coming around the next corner and you want to be right in a couple of days. But by the same token, you kind of want to, I think you want to find out why it happened, because often things keep happening. And I'm sure you've looked around at your mates and you think, well, they're on a medication, and they never go off them. They go on a blood pressure medication, they never go off it. They go on a cholesterol medication, they never go off it. So I think we need to look at both, and I think we can use both very favourably. But as I say, we're a little bit maligned because we're poorly understood, us naturopaths, and I think it's worth having a bit of a look and just seeing, because you might find there's a fit for you.
So I'm a dad, I'm sitting at home, I've got an issue, I don't know what that is. How do I decide whether I go and see a doctor or whether I come and see a naturopath?
Yeah, okay. Well, look, with regard to that, I suppose it's really whether you really want to know the cause of the problem, and also whether you want to be a part of the process, because you kind of hand over your health a little bit when you go and see a doctor. They are going to take over and say, well, look, this is your problem, this is what you do, thank you very much. But you don't often get habit change. You don't often get being told to do things or shown to do things that might prevent it moving forward. So if you kind of feel like there's a bigger picture you want to look at, and certainly looking forward, if you kind of go on medication and think, I want to get off this, that's the time you want to come and see a naturopath. So it's more about education, probably more about motivation and coaching when you come and see a naturopath, but it's definitely not about ongoing medication.